lacks. Both political and financial support for surveillance always goes down. And in the process, you find that when we don't allocate resources for surveillance activities, these zoonotic diseases, because they don't occur only in the human, they can also, they are sometimes in the animal side. So with the zoonotic diseases, you might find that as the disease is not seen in the human being, it might be now developing in the animal side. So we need the resources all the time to do surveillance across all these sectors, such that they should not take us away. Because if there is no surveillance both sides and surveillance only in one area, then the pathogen will be able to come from the other side and attack this side. So it is a common practice always that when the disease is not there, we try to shift our priorities to where we allocate our resources. And you find that people always ask, is there a problem? Currently there's no problem. And that's what usually makes us to be taken unaware and the disease spikes. So always it is a common practice. So we need to change. People who have the resources, people who have the political will, people who have everything, should really change that attitude.
In collaboration with CDC, Center for Disease Control, we've ensured that we improve on the capacity of the laboratories that were constructed here in Arua. So these laboratories continue receiving samples from partners like the Arua Regional Referral Hospital. If at all on the ground there's any case, where individuals might think that there's a need for investigation, the laboratories are open for such investigation. However, as I mentioned during the presentation, there is a need for systems that follow particular pathways in order for those that present with symptoms like that of plague, samples are shipped very fast to our laboratory. That time, in 2019,
referral system, whereby we are now working very well with traditional healers. These traditional healers, you know that they actually form about 45% of the health system. Most of the people go to traditional healers in the communities and they trust them. So we capitalized on that. Previously, the health systems never used to merge together with the healers, but under the program we are able to merge, to connect these traditional healers to the health system, and we have that referral system whereby traditional healers refer cases that they are not able to manage or cases that they suspect that could be plague. They refer to the nearest health centers and then they are investigated further there. And through that system, we have actually been able to detect some serious form of plague, that is the pneumonic plague, like in Logiri. We are able to detect that through the traditional healer system. And also,
Biringi Health District. We are here for the cross-border meeting about plague. That will help us in order to respond about plague, because you know the situation in this border. We have a porous border in this area. That's why this meeting is to take place. And since 2021, in Biringi Health Zone or Health District, we got 321 cases, among which 6 people died. Due to that, you know, we have to strengthen our knowledge in order to respond about this plague. And this will help us, first of all, to manage for managing plague breakout in the area. The first thing we should do, and which you have been told here, is that to find and stop the source of infection. That is the first thing.
For plague, but other diseases of epidemic potentials along the boundaries. I'm addressing myself to CDC, the funding.
Je m'adresse personnellement au CDC.
Because if we work on plague, what about hemorrhagic fever? What about
si nous travaillons sur la peste maintenant, qu'est-ce que nous allons dire about la fièvre jaune?
Because many people from DRC are accessing ARVs here. Following them up in Congo becomes difficult.
Beaucoup de personnes viennent de la RDC, ils viennent ici, peuvent avoir des maladies ici. Comment les suivre maintenant du côté de la RDC Congo? C'est difficile.
The RDCs around, there must be free movement of the experts here, the diplomats. Let me use the word diplomats.
Je voudrais dire aux autorités qui sont ici que nos diplomates qui sont ici, les invités, ils doivent circuler librement.
They should cross to Congo without any restriction. From Congo side, they should cross to Uganda without any restriction.
Ils doivent traverser du côté de l'Ouganda sans restriction et ceux d'ici du côté du Congo sans restriction.